Now we start scanning of abdomen by using convex probe, placing at transverse position at epigastrium. Here we see the left lobe of liver. Here we see that the left lobe of liver shows decreased echogenicity, and the margin of liver are also irregular. Now if we focus in the left lobe of liver, here we see a well-defined echogenic focal lesion. This is caudate lobe or lobe 1. It lies posterior to the portal vein. It increases in size when there is chronic inflammation of liver, and in chronic disease it compresses the portal vein and the diameter of portal vein increases in chronic liver disease. Here we see the duodenum, and these are gases in the duodenum and food particles. The walls of duodenum are not visualized and appears to be normal. Now here we scanning the pancreas. The pancreas shows normal echogenic homogeneous structure. This is Porter's planning conference. This is splenic vein. The pancreas lies anterior to the splenic vein, so it is easy to locate the pancreas when there is gases. First, you locate the portosplenic confluence and splenic vein, and then you can locate the pancreas. The pancreas is normal and no mass lesion present. Now we're rotating the probe from epigastrium towards side of the liver to examine the right lobe of liver. Here we see the fluid in the right subdiaphragmatic area, and this is air in the lungs. Remember that we will examine the liver from all sides to find out any pathology. Here we see multiple focal lesions also present in the right lobe of the liver. Here we see the heart, and this is inferior vena cava. Now we scanning the right lobe of liver between the ribs. Here we see a well-defined isoechic mass in the right lobe of liver. The mass is well-defined rounded shape. Now we will measure the size of this mass. The size of this mass is 28.7 into 24 millimeter. Now we scanning the liver from right lumbar area. It is also called craniocaudal view. Craniocaudal view is used for liver size measurement. For that, the probe is placed at longitudinal position towards the left lobe of the liver. So we will take the exact size of the liver from right lobe to left lobe of liver. The size of liver is 14.7 centimeter, which is normal. The normal size of liver is up to 16 centimeter. Now we will measure the portal vein, which is also dilated in the chronic liver disease. For better measurement of portal vein, patient should be positioned at left lumbar area and probe is placed at mid-clavicular line in the right hypochondrium. Then we can easily locate the portal vein and common bile duct. Now we will measure the size of portal vein. The size of portal vein is 11 millimeter, which is normal. The normal size of portal vein is up to 12 millimeter. Here we see the gallbladder. The gallbladder is partially contracted. No stone or mass seen in the gallbladder. But the walls of gallbladders are less echogenic and thickened. Now we will measure the size of gallbladder wall. The gallbladder wall thickness is 4.8 millimeter, but the normal wall thickness of gallbladder wall is 3 millimeter. So this thickness is occur due to chronic inflammation. Here we see free fluid. This is right kidney, which is appears to be normal. No stone mass or hydronephrosis present. This is spleen. It also shows decreased echogenicity, but the size is appears to be normal. This is diaphragm and this is left lung. Tissues. Now we will measure the size of spleen. The splenic size and index is 96 millimeter and width is 52 millimeter, and it is mildly enlarged in size. The normal index of liver is 45 millimeter. This is left kidney, which is also appears to be normal. No stone, mass or calculus present. Now we scanning the pelvis. Here we see the gut loops and free fluid between the gut loops. Now how we will write report.